One useful strategy for effective risk communication in healthcare settings is called balanced framing. Balanced framing is the process of describing both the positive and negative risk perspective. For example, chances of survival and chances of death, or chance of side effects and of remaining free of side effects. A choice expressed as offering a 97 out of 100 chance of being cured is psychologically more acceptable than a 3 out of 100 chance of dying. Consider the case of a 65-year-old woman who comes to her doctor's office for a yearly physical exam. Her physician plans to discuss the patient's risk of osteoporosis and hip fracture and options for prevention. One option for hip fracture prevention is to take the drug alendronate. The following is an example of using balanced framing to communicate the risk and benefit of taking alendronate for this patient. Mrs. Parsons, for every 100 women like you, over the next 10 years, about 20 will suffer a broken bone and 80 will not. Taking alendronate will reduce the risk of fracture from about 20 to about 10 out of those 100 women. In other words, 1 in 10 women will avoid having a fracture because she took alendronate. Research has shown that descriptive terms such as low risk tend to reflect the speaker's or clinician's perspective and offer little help to the patient who seeks a clear understanding of the risks attributed to each available medical care option. Try not to present only the negative perspective or frame. Describe outcomes in both positive and negative frames.